Okay. Hello, everyone. I'm Varsha, and I completed my MSc in Health, Wellbeing, and Sustainable Buildings. And my dissertation topic is assessing the effectiveness of passive cooling design strategies to reduce overheating in epilepsy care homes in the UK. My dissertation was completed under the guidance of my supervisor, Dr. Anna Mavrogiani. According to the UK CIP report, the UK climate is becoming warmer, with the Central England annual average temperatures rising on a high emission scenario in both the summer and winter periods, respectively. Groups at a higher risk of overheating are especially children, elderly, people with lack of adaptation, and physical disabilities. By the year 2050, the demography of the UK will be different from today, with many people living longer and with a larger aging population. Any increase in overheating will have a greater significance in terms of health-related illnesses and mortality. A survey regarding the relationship between epilepsy and overheating by the Epilepsy Society has shown that 62% of the people with uncontrolled seizures experience an increase in their seizure activity during unusually hot weather. Lack of adaptation, being confined to the bed, physical disabilities, disabilities due to age, and dependence on carers affect patients in care homes. Excerpts from existing studies indicate that climate change has an impact on epilepsy either directly or indirectly. Thus, it is essential to consider health effects of indoor temperature exposure for care settings with residents experiencing health conditions, low mobility, dependence on carers, which leads to spending most of their time of the day indoors and thereby affecting their health and well-being. Existing literature recommends using passive ventilation through dynamic window opening schedules and shading through external shading devices and internal shading strategies such as blinds and shutters to prevent overheating. However, there is a gap in research currently, as there is little literature on how to mitigate overheating in care facilities specifically designed for people with epilepsy. Thus, the aims of the studies are twofold. The first being to investigate the effectiveness of a range of passive building retrofit and operation strategies using dynamic thermal modeling to mitigate the effects of overheating and in maintaining a thermally comfortable and healthy indoor environment for care homes for people with epilepsy. The second is to examine if the passive design strategies are adequate to mitigate the risks of overheating during climate change in the future scenarios. The overarching study methodology is described in the flowchart below, which involves site visits to the care home, primary and secondary data collection, modeling of the base case, selection of current and future weather data files, selection of overheating assessment criteria, testing of passive design strategies and the impacts of climate change, and finally concludes with the formation of overheating adaptation guidelines. The first step was to visit a care home for epilepsy and understand and to collect primary data and secondary data. The next step was to collect primary data such as construction materials, floor plans, occupancy schedules, understand the appliance usage and window operation schedules, which were collected through on-site and also on-site environmental conditions first collected. Next, the secondary data used for the study consisted of a thermal comfort survey with carers and environmental monitoring using data loggers to capture the environmental conditions such as temperature and humidity levels during the summer period at the care home. Next, a baseline model is created of the care facility to replicate the real-world conditions of the care home to understand how the building performs during a overheating period. The construction parameters collected during data collection aim to replicate the real-life conditions of the care facility. Weather files selected for the current and future scenarios of the current period 2050s and 2080s replicate help in assessing the current and future risks of overheating. Next, monitored data and thermal modeling results are compared to provide modeling robustness and provide validity for the results. After the modeling results are tested in the baseline model, numerous passive design strategies were tested to understand the impacts of each strategy in reducing overheating. There are a mix of soft and hard adaptation measures. Soft measures referred to the behavioral strategies which were cost-effective with low disruption, and hard measures for structural changes that which incurred costs. Finally, a list of combination strategies were tested to understand the cumulative effects of each individual strategy, which are listed below. Multiple overheating criteria were used to evaluate the risks of overheating. Some of them are CIPSE TM52, CIPSE TM59, CIPSE Guide A, and the UK HSA guidance. For this presentation, the UK HSA's overheating assessment criteria with the 26 degrees threshold is used for this study. Looking at the results for the base case analysis, it shows the current and future scenarios results. It is seen that all model rooms experience varied levels of overheating in the current scenario, and the effects of orientation and floor height also impact overheating. And overheating hours in the high emission scenarios for the years 2050s and 2080s are at least double or triple the current scenario respectively. Next, the passive design strategies discussed previously were tested for some of the rooms in the current scenario to see the effects it has on reducing overheating. For the current scenario, in the individual strategies, it is seen that night ventilation was the most effective strategy in reducing overheating, which is strategy S9, followed by strategy S6 and S7, which are shading strategies, which are fixed and adaptable shading strategies. Looking at the combination strategies, the most effective strategy is C5, which is a combination of shading, ventilations, spectrally selective glazing, high albedo materials, which results in 0% of the hours overheating during the current scenario. It was also seen that all combination strategies were more effective than individual strategies in reducing overheating. So they were next tested for the climate change scenario to test their impacts on overheating. These are the results for the climate change scenarios for the combination strategies. It is seen that in the future scenarios tested with the implementation of combination strategies, it is seen that overheating is still present in the future, but the overheating hours are significantly reduced in comparison to the base case. This implies that the usage of passive cooling techniques aids in reduction of overheating in the climate change scenario and helps in maintaining thermally comfortable indoor temperatures. These are the conclusions of the study. This study assessed the indoor overheating risks in a case study care facility for people with epilepsy under the current and future climatic conditions, and quantified the effectiveness of a wide range of passive design strategies to minimize overheating using dynamic thermal modeling. It was shown that maintaining indoor temperatures below the threshold of 26 degrees by the UK HSA using a combination of passive design strategies and measures could be achieved for the current climate. The individual strategies that have the maximum reduction of overheating while being economical were ventilation strategies such as night ventilation, passive daytime ventilation, and then followed by adaptable internal shading. Combination strategies using ventilation and shading were beneficial in further reduction of indoor temperatures. The most suitable combination strategy used both hard and soft measures such as ventilation, shading, highly efficient glazing, high albedo materials, but the cost implication of such refurbishment strategies might inhibit their usage. For future climate scenarios, passive strategies will help in reducing indoor temperatures, but might have to be considered in the context of hybrid cooling systems or active cooling. The findings can assist construction professionals, policymakers, and public health researchers to create guidelines for climate change adaptation for care settings. This study provides important insights regarding summertime overheating and summertime temperatures for current and future scenarios in care settings for epilepsy, and raises queries regarding the preparedness of these facilities against extreme temperatures and climate change. Thank you.